Welcome everyone, this is Dr. Mercola, and today I am joined by Dr. Graig Buhler, who is a chiropractor extraordinaire whose work focuses on the interrelationships between muscle function, range of motion, and restriction that contribute to pain. So in 2002, he established the advanced muscle integration techniques in a clinic in Utah, where I've actually seen him as a patient. And he treats both, and one of the compelling reasons that motivated me to see him is that he treats both world-class professional and Olympic athletes, as well, of course, as the general public. So thank you for joining us today, Dr. Buhler. It really is an honor, privilege to have you join us. And I'd like to comment initially that have some experience with chiropractic for some time now, and certainly in my observation in innovators in the medical profession, it's been my experience that some of the most profoundly innovative physicians that are introducing techniques that have enormous healing potential are really the chiropractic profession. Now, certainly it's a small percentage, but some of the most amazing techniques I've ever been exposed to were developed by chiropractors, and yours is certainly one of them. So we're going to have you here today to explain that in more detail. And one of the reasons that I was particularly compelled, I think I first heard of your work through Jeff Hayes, who is the producer of the film that as we're filming this, Doctored, which has just been released. And both you and I are in the film. And he exposed me to your work primarily through his experience through some of the work you've done with the professional basketball team, the Utah Jazz, where you were the team physician there for the chiropractic physician for 20 years, I believe, and as a result,
26 years.
26 years. So as a result of that, working with them, they had the lowest injury rate in the NBA.
Yeah, it's amazing. We're just about a week away or 2 weeks away from submitting a 25-year study of player missed game due to injury rates in the NBA. And once we began to analyze the data, it showed that the Jazz, in fact, had the lowest injury rate of any team in the league for the 20 years that I had complete access to the players. And the average, well, our average for those 20 years was 61 player missed game due to injuries, and the league average was 171.
Yeah, that's
and
quite.
It makes the Jazz an outlier. And then when I stopped having access to the players, we had the most rapid increase in player miss game due to injury rates in the league in the history of that 25-year period. So, it validates what happens when you use the technique that I've developed and integrate it with good quality medical and training care.
Yeah, and this is particularly important, especially for someone like myself who's so passionate about exercise and using it as a tool to optimize your health, that invariably, when you participate in an aggressive exercise program, you're almost bound and inevitable to become injured because of the normal imbalances. And just the very act of exercising is going to make it worse, so that you wind up get worse and worse all down the road. So unless you have an intervention that can A, identify that, and then B, importantly, correct it, you're kind of walking down a path towards misery and restriction of motion and pain as you age. And so why don't you tell us a little bit about how you developed your technique, and because it's really quite an interesting story.
Well, it started with really basically back with Dr. George Goodhart, a chiropractic physician from Detroit, Michigan, who started what's called applied kinesiology. And he discovered that there were relationships between organs and glands and muscles and the vertebral levels in the spine. Dr. Alan Beardall studied with Goodhart, and Alan was a nationally ranked distance runner, and so he treated a lot of elite distance runners.
Boy, I didn't know
and he
that.
Found that.
I never realized he was a long-distance runner.
Excuse me?
I never realized he was a long-distance runner. But as you share with me, he's really probably one of the master innovators in the entire profession, was Dr. Beardall.
Yes, yes. But Dr. Beardall found that elite athletes would come in with various types of injuries, and he would apply the chiropractic techniques that he learned and applied kinesiology techniques that he'd learned. And a lot of conditions got better, but others didn't. or they'd get better until the athlete would get to a certain mileage and then they'd break down again. And he said, there's got to be a reason why they break down. And so he launched into a very in-depth research project of trying to look at relationships, and he studied all the techniques in chiropractic to find out where they fit, where they worked, where they did not work. And it was a long process of a clinical investigation. And when he added the acupuncture component to it, things went to a whole new level. He defined 8 reflex systems for 310 muscles in the body. And at the time, Goodhart had discovered reflexes for about 85 muscles. So Alan took Dr. Goodhart's work and expanded it dramatically. He redefined anatomy. We defined divisions to muscles, and like the quadriceps are considered 4 muscles. In reality, there are 12 divisions to those complex muscle systems. And he developed ways of isolating and testing those muscles. So we can go through an athlete, or anyone for that matter, isolate every single muscle in their body to determine whether they're neurologically and proprioceptively intact. And we can find areas of instability, which shows us where a person's vulnerabilities to injuries are. And that allows us to predict where injuries will occur. And that's why we were so effective with the Jazz. And I worked with the Broncos during the 2 Super Bowl years, and I've worked with elite Olympic athletes, kids that were trying to make an Olympic team and actually won medals, simply because we could define where their imbalances were and correct those so that their training became more productive. And so it makes this approach probably the most specific approach to assessment, diagnosis, and treatment of anything that I've seen out there. And I think the reason it's so profound is it integrates so many really good techniques. I mean, acupuncture works, but it doesn't work all the time. Chiropractic works, but it doesn't work all the time. You have all these different therapies. And what Beardall asked was, where do they fit, and how do we make them come together? And when he did that, we saw tremendous changes.
Yeah, and if we can superficially at least, because there's obviously there's a whole complexity to what you do, but the simplification would be that we have basically all of our muscle systems, they can be either functioning and working properly, or they can be inhibited and turned off. And then you have a tool which uses muscle testing,
Yes.
But it's pretty easy to tell if your muscle is off or on. And if it is off, then you have a series of pressure that you that you apply to the origin and insertion of the muscle. And this is the key, and we'll talk about the difference between other techniques and it's sort of the story behind how those developed. But then you apply pressure to these reflex points, these either neurovascular reflex points or acupuncture points, that ties it in and makes that correction by putting that pressure more permanent, so that the muscle's always functioning unless it becomes re-injured for some reason in the future. And maybe you could clarify that or expand on what I just said. So,
well, what we discovered years ago was that if a muscle is overloaded beyond its ability to handle the stress, either because of lack of conditioning or because the trauma is too severe, one of 2 things happen. You either tear the tissues or the nervous system deactivates it through a series of reflexes called proprioceptors. Now, the way the muscle system and the nervous system relates is within the belly of the muscle, little fibers called spindle cells. And those spindle cells monitor stretch. And if that muscle is overloaded too rapidly, those spindle cells inhibit the muscle, but it's a temporary inhibition. So the next time you contract the muscle, it fires. Beyond that goes into the tendinous attachment of the muscle, and there are cells in there called Golgi tendon organs. And they also measure and monitor stretch. So that tendon is stretched too rapidly or exceeds its integrity, those little Golgi tendon organs inhibit the muscle temporarily. But the next time the muscle fires, it'll fire appropriately. But there's a fail-safe system. It's where the tendon attaches into the periosteum of the bone. And the little fibers there are called Sharpie's fibers. And those fibers are loaded with little receptors that monitor tension. And if those fibers are exceeded, then they inhibit the muscle just like a circuit breaker would inhibit an electrical circuit. Once that happens, the muscle will still fire under passive range of motion, but if you load the muscle, it gives way. If you continue to load the muscle, the body creates pain at the attachment points to protect you. And so what the central nervous system does at that point is computes an adaptive strategy by throwing stress into the muscle next to it. So other tissues begin to take on more of the load for the muscle that's been injured. That locks into the neurology, and you develop different movement patterns or adaptive movement patterns. And so that takes the stress off the muscle that's been injured and allows that to heal. The problem is that the muscle that's been adapted to is at a mechanical disadvantage to a certain plane of motion, so it's more prone to injury. And so that becomes the next site of injury. So we go from one injury to the next. And before long, there's nothing left to adapt with. And so you end up with chronic pain every time you engage those muscles. So what happens at that point is the muscles tend to tighten to try to stabilize. The body works to be stable, and it does that in any way it can. And that's when we end up with these chronic problems. Now, what's really been interesting is that once those muscles become inhibited, they lose their ability to inhibit their antagonist muscles. So, for example, people have chronic hamstring problems. They go in for therapy, they get stretched, they get massaged, they have all kinds of therapies to the hamstrings, and they feel good temporarily, but the next day they're tight again. Chronic hamstring tear or pull, the same thing. It's time and time again, they go in for therapy and it just never really does settle down. Well, in my model, the hamstring is the symptom, and the cause of the problem is that certain of the quadriceps have been inhibited. Because ordinarily when a muscle contracts, like for example, the quadriceps, they send inhibitory impulses to the hamstrings to cause the hamstrings to release. And then at the mid-stance gait, that shifts. The hamstrings contract, and they send impulses to the quads to cause the quads to inhibit. It's called Sherrington's law of reciprocal innovation. That's how we move in a coordinated manner. But if a muscle has become neurologically and proprioceptively inhibited due to injury, they lose their ability to inhibit their antagonist. And so their antagonist stays tight through all planes of motion. It never completely releases. And so when a person has chronic hamstring problems, it's because the quadriceps have become inhibited. And so when people come in with hamstring problems, invariably I find a group of the quadriceps shut down, and once I reactivate, they get off the table, the hamstrings are clear, and they're no longer having problems with tight hamstrings. And it shocks most people because everybody thinks, well, you treat the symptom site. The question you have to ask is, with any problem, is this the core problem, or is this the adapted problem? Because you never treat the adaptation, because if you do, it never gets better. Mm-hmm. And that's what makes this approach so profound, is we focus on the key cause of the problem. And so we get dramatic changes.
Yeah, it was really one of the characteristics of your approach that really resonated very well with me, because my focus in everything I teach is really to really address your energy to the cause, not treat the symptoms, which is almost exactly what the traditional medical care does, is treat the symptoms, except they would go a step further and they would just use a drug to treat it, typically like an anti-inflammatory, and cause other complications. So with my experience, interesting, like Dr. Beardall, I was a long distance runner and had developed probably injuries to my quads and all that time. And then as a result of trying to implement what I now teach as the peak fitness program, where have these high intensity exercises, and specifically sprinting, I had some pretty severe injuries to my hamstrings. So and when I went in there, you would assess these, and maybe before we go into those details, why don't you describe what a visit looks like and what the process is to identify an injury or complaint or pain to the point of the whole diagnostic strategy and therapeutic range not range, but approach that you use to improve that person's complaint?
Well, the first thing that I do is a case history, because I need to understand the history of the patient's injury, the health problems that they've had through their lifetime, because that gives me kind of an insight as to just how broken down they may be and potential sources of their problem. And then I do a full assessment of just basic muscle function, because what I've found as a chiropractor, I've got to make sure that the central nervous system is functional. And the atlas axis occiput complex, which is the upper part of the spine, is very complex. It's the only level that affects the brain stem or the central nervous system directly. The brain stem passes through the foramen magnum in the base of the skull, through the ring of the atlas axis to become the spinal cord. So any distortion or dysfunction within that complex can lead to compromise on the neural function of the brain stem. And I find a global effect of that. And so when I find that, then I do what's called a toggle recoil adjustment to reset that segment, or those two segments, back into proper motion. And then from that point, I start from the head and I go all the way down to the feet, and I isolate every single muscle to determine the neurological integrity. So I'm not testing for strength, which would be seen in break testing, which a lot of physical therapists and chiropractors do. What I'm looking for is the tonal quality of that muscle. Can they engage? And what's fascinating is that as you position a body in the area of the muscle range of motion, if the muscle is intact, it's easy. The patient's body moves into that position and it locks in very effectively. But in a muscle that's inhibited proprioceptively, the patient will resist moving into that position, or they'll recruit other muscles. They're trying to adapt around the error. And so I have to be very precise in making sure that I get their body in the right position, and when I challenge the muscle, it's weak. And I find that not only in housewives, but in professional football players. Professional athletes and elite athletes are really difficult to test because they become so masterful at recruiting and adapting around their imbalances. But once I get them aligned properly and isolate that, I can overpower them with 12 pounds or 8 pounds of force with hardly any effort on my part, and they cannot control it.
Even these are athletes that may be able to bench press 400 or 500 pounds.
Yeah, well, yeah. There was an lineman I evaluated that could bench 520. He dumbbell pressed 230. The guy was massive, but he had a chronic shoulder problem. And when I started doing an examination of his shoulder, he would roll his whole body to recruit. And so I had a hard time getting him back in position. Once I did, I overpowered him with my fingertips. Yeah, I mean, you think about it. He got that strong by recruiting other muscles, and yet he had this chronic problem. Well, once I defined the muscles that weren't working, he was blown away that I could overpower him with that little amount of force. Once I treated him, those muscles locked in rock solid. I could not budge him. He moved in position effortlessly, and his shoulder pain was gone. But the key is you've got to define where those positions of instability are first. That gives you a blueprint as to what you need to do. And so then we begin the therapy process, which is really an innate guided systems approach. The body creates symptoms as a way of communicating to your mind ego that there's a problem. But we've learned through our conditioning that we just ignore the pain, or we take a medication to suppress the pain, which is no more than saying to the body, shut up, I don't want to hear about it, which allows the problem to become more advanced. And so if you're taking anti-inflammatories and pain pills for a condition that you're dealing with athletically, all you do is set the body up for more damage, because you override the protective mechanism of the body. So this approach honors the body, listens to the body, uses symptoms as a languaging system so that I as a physician can translate that into usable information. And people will come in, one visit, they might have pain in the right shoulder. We'll go through the exam and see, okay, there's certain muscles, we'll test them, we'll find the one that's a priority, we'll treat it. It's like the body says, thank you very much for fixing that, now fix this. And the next time they come in, their left hip is going to hurt. And so we'll find the muscle that needs to be treated there, we'll fix that. The next time they come in, the opposite hip. So it's like we break down in layers. Now, I can't get to this layer here until I solve this, but once I do, I expose this. And so the amazing thing is the body unveils itself layer by layer, and we'll get to a place where a person will say, I'll say, when did you injure your hip? Oh, I did that in college playing football, but it doesn't bother me unless the weather changes. They didn't tell me that in their case history, but the exam revealed it. So I can take a patient and not ask them a question, do my exam, and I can tell them exactly where they've been injured through their lifetime, which blows most people away. But you say, it should have healed. Pain went away, it healed to a degree, but you were still left with the inhibition and the instability, and your body merely adapted around it. And that's why as we get older, all those old injuries we had in high school or college start to show up again. It's like, wait a minute, if it healed back then, how come I'm dealing with it at age 50 or 60? And this model explains why that is.
And some people might argue against this model, from a evolutionary perspective, that our bodies were designed to recover. They have the ability, intrinsic ability to heal. And in your theory, once you have this injury, it tends to remain until you're dead. I mean, it doesn't spontaneously heal. And I guess the response, because I had this discussion with you when I was in your office, and your response, maybe you were certainly more eloquent at explaining it, but I'm wondering if you could expand on that, because my recollection is that it's this adaptive response that you refer to that allows you to continue and to gather your food and engage in most normal daily activities, but without the full range that you were designed to. So can you address that? And then I have some other questions I want you to
Certainly. Like I said before, when a muscle inhibits, other tissues take on more of the load. So you develop these adapted movement patterns. They become entrained into the central nervous system. And so they become your primary movement patterns. And so it's like if somebody's in a bad accident and they're hospitalized for 4, 5, 6 weeks, they kind of have to learn how to walk again, because their central nervous system has lost the proprioceptive feedback of how to walk. And so if you take a muscle offline, your central nervous system loses touch with that movement pattern, that proprioceptive movement pattern. And so we just become less efficient, but we're successful in our adaptation and the pain goes away. But as you know, as we age, the tonal quality of our muscle system, our strength begins to wane due to hormonal changes and so many other factors. And so as we age, we're more prone to display those imbalances that we've accumulated. And I've always wondered, why can't the body reactivate its own systems? And the only way I can explain it is that we just developed these adapted neurological pathways, and we never access the other ones. Does that make sense?
It makes sense, and it becomes more important because as you age, when you're young, maybe that's a better way to approach this, you tend to fail to appreciate the full range of motion and freedom from pain that you have. But as you age, you get older and you acquire these injuries and you start to degenerate. When you lose that flexibility, that mobility, and you start having pain in certain movements, it becomes a real major issue in your life. And to have these tools to restore your vitality and flexibility to the point of when you were an adolescent or a teenager, it's just magnificent. So,
well, the NBA did a study in 1981 where they looked at longevity of players in the league, and they looked at the primary reasons athletes retired from the game. And the number one reason was axial skeletal problems, joint problems. And the number one axial skeletal problem was jumper's knee or patellar tendonitis. And in the report, they indicated that one of the things they observed with patellar tendonitis was a restriction through internal hip rotation. And they mentioned that it was an interesting finding. They didn't do anything with that because they really didn't know what to do with that. But in my world, I look at that and say, okay, if they're restricted through internal hip rotation, the internal rotators have to be inhibited. So when athletes or patients come into my office with patellar tendonitis, they all have restricted internal hip rotation. Now, in most models, you'd say, well, the external rotators are tight, which they are, so everybody wants to treat the tight externals. But in my model, I look at the fact that the internal rotators have become inhibited. And that's usually the gluteus medius anterior division, the tensor fasciae lata. And once I clear those muscles, their internal rotation normalizes. It's no longer restricted. And they get off the table and the knee pain's gone. And we see that a lot with our skiers, our Olympic downhill skiers. When they've restricted through internal hip rotation on the right, they have a hard time making left turns. The right turns are fluid, their left turns, they struggle because they've lost that internal hip rotation on the right side. Once we clear those muscles, it immediately changes and normalizes motion. And they go back up on the slope, and it makes a huge difference in their performance. Mm-hmm. So those are just some of the things that we observe as far as restrictions through movement. And so if you can give people back their motion and then get them in a program like yoga or some type of training program to strengthen those muscles that have been inhibited, and you move that person to a whole new level of performance, especially with athletes. The changes are dramatic. I mean, we see times dropping. We've dropped the time of a 5,000 meter speed skate by a minute and a half simply by clearing the calf muscles and the quadriceps. That was done in 24 hours. We've increased vertical jump on a basketball player by 7 inches in 20 hours simply by reactivating the quads and the calf muscles. That's staggering. That's unheard of. But it's an example of what happens when you reactivate and reinitialize those muscles back into the nervous system. It's pretty dramatic.
Yeah, it's interesting too, because it can become so frustrating to the typical person who's motivated to improve their health, to engage in these exercises, takes the time, effort, and energy, and has the discipline to engage these practices, yet has not seen results. And it's almost physically impossible to achieve the results because of the injuries that they've had from previous encounters in life.
Exactly.
So I'm wondering if you could comment a bit, because you kind of brushed over it. What you said was correct, but I don't think that many people listening really understood that. And I'd like you to share this too from the perspective of being such a major innovator, really one of the pioneers in the whole profession of chiropractic, and developing a technique that is just so extraordinary and so useful. If you could share with us your journey and how you came to your approach, because you started out as just with regular tools, and maybe share the frustration you experienced and some of the encounters you had, specifically in the transition to learning the Atlas technique and how that got you to a new level, but yet there was still levels beyond that you needed to do.
Well, I was supposed to be a businessman. I was supposed to take over my dad's business, and it hit me one day that was not what I was here to do. And I went to a chiropractor for migraine headaches because I couldn't get results from the medical profession. And I ran track for the University of Utah, a quarter-mile relay, and I was plagued with a foot injury every season. Every time I cranked at the next level, I would break down. And I was at the Black Outdoor semifinals, and I ran my fastest race, but when I finished the race, I was in so much pain I couldn't walk. So as a result, I couldn't run, so I lost my scholarship, dropped out of school, got married, and a few years later, I went to a chiropractor for my headaches. At the time, my experience or understanding of chiropractors that they were quacks and they were dangerous, and all the things that my medical doctor had told me. So I never went. But I was desperate, and I was disappointed, frustrated with medical care because they could never really help me. All they do is give me medications. So I went to this chiropractor, and he did an exam, and he brought me back and did a report, and he explained why my foot was in pain. He gave me a first treatment, and he adjusted my ankle, and I got off the table pain-free for the first time in 5 years. And that's when I realized there was more to chiropractic than I'd been told. And then as I started to investigate it, I found out there was a 4-year program equivalent to medical or dental school And then I really got angry because I realized I'd been lied to. The medical doctor that I'd gone to told me it was a 4-month mail order course. And I was shocked. And then as I went through the process of care, my migraines went away for the first time since I was a little kid. And that's when it's almost like the spirit moved on me and said, you know what, this is what you are here to do. So I checked all the different colleges around the country, and I was through a series of fluky events. I ended up in Western States in Portland, Oregon, and I looked all over for a place to live, and we drove into an apartment complex, and it just felt right. So we rented an apartment, and Friday went to school for our orientation, and Dr. Alan Beardall and his wife spoke to us, and as he talked, I had this impression I really needed to get to know this guy. I didn't know him from Adam. The Sunday went to church, and one of the members came up and introduced herself, and she asked where we were from, and we told her, and why are you in Oregon? Well, we're going to chiropractic school. She says, oh, you need to meet my chiropractor. His name's Alan Beardall. We're having a dance in a couple of weeks. I'll introduce you. So that was my introduction to Alan Beardall, and he took a liking to me, which he didn't allow students to come out to his clinic, but he allowed me to come out and observe after school. And then I worked with him full time through a summer. And this was during the time he was actually developing this work. And it was fascinating to see what he was doing with athletes and looking at all the different techniques. And he had walls filled with chart of different techniques and comparing and contrasting to see where they fit. And out of that, he summarized so many techniques. So we were able to solve a problem that would take eight treatments to solve with one visit. And so I got a great education. And then after I graduated and I moved back to Utah, I continued to study with him until he was killed in an auto accident about 26 years ago in England. So I've just continued to expand it and fine tune it. But I've taken a lot of different techniques through my career, and it's perfected my skills. The OTC, Dr. Francis Murphy has developed, curing frozen shoulder with one adjustment. That's unheard of. He's documented over 1,500 cases of frozen shoulder cases, diagnosed medically, scheduled for surgery, one adjustment, full range of motion comes back. I studied with Dr. Stober, a naturopath chiropractor in Oregon, who developed what's called a nasal specific cranial technique that changes lives. It's just been, I've attempted to try to pull the best out there and integrate those into this process called advanced muscle integration technique. And the doctors who take my seminars are blown away. Their practices start to take off. They come back to following seminars like kids at Christmas time. They're so excited because the results are producing. I mean, you talk to people about this stuff. I mean, you talk to John Stockton, and he'll tell people that the things that he's experienced when I was working on them. They won't believe him. Mm-hmm. On my website, there's a video clip, John Stockton spraining an ankle. And when you see it, you cringe and you swear he fractured his malleolus and probably tore all the ligament.
Was that the game where he was playing against the Chicago Bulls in one of the finals for the conference finals?
No, that was a different game. That was that ankle sprain occurred when that was his last season with the Jazz. That was the year that he retired from the league. But it was a playoff game, and we ended up winning that game and going into the second round. And had he not been able to play, he contributed a lot to that team. So,
well, this is probably a good place to comment on a technique you develop for sprained ankles, because typically a pretty severe sprained ankle will take a person out, whether it's an athlete or just a regular exerciser, for a few weeks, if not months. But you have an approach that literally, where you do these ankle manipulations and movements and correct the issue that was at fault, and once that's restored, actually engaging in normal activity gets them back within minutes. But why don't you explain that and expand it, because it's really a phenomenal story.
Well, Standard of care medically, when you have a severe ankle sprain, you've got three different grades. From grade 1, which is a overstretch of the ligament. Grade 2 is a slight partial tear. Grade 3 is a complete tear. Grade 1 and grade 2 sprained ankles are really an easy fix, but the standard approach medically is to unload it for at least a week, so you're on crutches. The second week, you start with passive range of motion, doing maybe some therapy. The third week, you get a little bit more aggressive, and you continue that until the athlete or the patient can begin to weight bear, and then they gradually work back into their regular routine. That can take between 4 to 6 weeks. Well, in this model, we look at it a little bit differently. During an inversion sprain, which is the most common sprain, the talus, which is the top bone in the ankle, rotates, and the calcaneus counter-rotates. The long bone on the outside of the ankle, called the fibula, drops inferior and shifts backwards at the attachment in the knee. That changes the dynamic of the joint mechanoreceptors. And so any kind of weight bearing on those joints are severely painful. The lateral stabilizers to the ankle muscle become inhibited because of the trauma. So they no longer fire to support the joint. So every time you take a step, you're stepping and weight bearing on a joint that's distorted and unstable, and the body automatically creates pain to protect you. You get the swelling because of the capillary hemorrhage, and the body again is having to deal with an inflammatory process and begin the healing process. What we do is adjust the ankle mortise back into alignment so the joint tracks properly. Then we reset the lateral stabilizer muscles with the reflex work that we do. So when we start and I challenge those muscles, they're painful and weak. When I activate, we go back and retest, rock solid, no pain. So now when the athlete or the patient gets off the table and begins to walk, the first step is painful, the second step is less painful, each subsequent step they take is less and less painful to where they can run back and forth in the clinic without any pain. That way, walking and running actually becomes therapeutic because you're stimulating lymphatic drainage, you're stimulating circulation, the proprioceptive mechanism of the joint itself and the muscle, the connective tissue, begins to reinitialize back into the system. Now, that doesn't mean that you still don't have healing to take place because you still damage tissue, but at least you're stable, and you tape it back up, and the athlete goes back and performs. Usually takes an adjustment the second day, but after that, they're good to go. And that's the thing that was amazing for new players that would come into the Jazz. They were used to standard medical care for a sprained ankle. And the veterans, like Stockton or Malone, would say when they'd sprain ankle, get in see Buhler. Or the trainer would say, get in see Buhler. They'd come in, I'd evaluate them, set the joint, reactivate the muscle. They'd get off the table and walk and get this strange look on their face, like, I don't believe this. The pain's gone. I say, yeah, but the pain's gone. I say, I know. And they say, how do you do that? So it sounds magical. And the physicians for the Jazz, the orthopedists, would freak out every time I would do that. And it was a source of some major conflict. I was accused of treating physicians shouldn't be treating. And I was told numerous times, it's not good medical care to jerk on an acute traumatized ankle. And I would say, I understand it's not good medical care, but it's excellent chiropractic care. And players they got a sprain, they just come in and know that they'd be back out on the court. And, if it were a grade 3 sprain, that's different. You've got a surgical situation there. And that's where your diagnostic criteria come in play, is that you need to assess it to see, okay, how severe is this? And, even an avulsion fracture, if you reactivate the muscle and it doesn't turn back on, that's a red flag. You've got a pathology, and they need to be sent out for further evaluation. So the nervous system will guide the diagnostic process. And so it gives you the opportunity to use conservative care first and then move to the more radical care.
Yeah, well, thank you for expanding on that dramatic anecdote that really confirms how valuable your approach is when you can achieve those types of results in such a quick manner. I'm wondering if you could also go back and comment a little bit on the integration of the Atlas techniques. I didn't, till now, didn't realize you were actually a protege of Dr. Beardall. I didn't realize that.
Yes.
And could explain your quick start because, you know, as I mentioned earlier, he appears to be one of the primary innovators in all of chiropractic profession. I mean, probably the guy is Dr. Beardall. So he took you to his liking, so you're one of his proteges. So I'm wondering if you could explain how you've integrated Atlas, because there's the Atlas technique, which is the first cervical vertebrae, because there's a fair number of chiropractors who that's the only thing they focus on, and they get really dramatic results. So if you could comment on that, and then also on how you were able to integrate that and improve Dr. Beardall's approach.
Certainly. When I went to Western States Chiropractic College in Oregon, we were exposed to the Atlas axis, but it wasn't that well presented, because the basic philosophy from the beginning of chiropractic is that a subluxated or displaced Atlas axis interferes with the innate expression of the body. And so those imbalances that occur in blocking the central nervous system lead to all kinds of diseases and health problems. And so the innovators, the original innovators, D.D. Palmer, B.J. Palmer, that was their primary focus. And then as time went on, there were different philosophical camps that evolved. And so that whole concept of innate intelligence was part of this occult, ethereal philosophy that is seen in scientific circles as kind of hocus pocus. So we didn't learn that in chiropractic college. We learned how to manipulate the joints, but we really never understood the dynamics of Atlas axis occiput. So I've been in practice about 18 years, and I'd listened to some of these old timers lecture, and they were saying, doctors, if you're not seeing miracles in your office every day, you're doing something wrong. Well, I would see miracles in my office once in a while, but not every day. And I would think these are guys on some kind of medication, because I just don't see that. Well, I heard it enough times that I started to question, maybe I'm missing something. So I visited a friend of mine back east who was very principled chiropractor and has done a lot of upper cervical work. And he said, you need to come to ADIO, which is a seminar put on by chiropractors that focus on the upper cervical. And I sat there listening to people like Donnie Epstein, who developed network spinal analysis, and Dr. Sigafoots and Dr. Kale. And they were all telling these amazing stories of miracles in patients' lives. And I said, I need to learn this. So I took seminars from Dr. Kale and in the South. And he had taken BJ and DD's Palmer's work and condensed it into very precise concepts. And I learned about toggle recoil in the upper cervical area. And so I came back to my practice and I put all my muscle work on the shelf, and I said, okay, I'm going to see just how effective upper cervical work is. So I started doing that on all my patients. I started seeing miracles in my office every single day. And what was interesting is people started calling in as new patients with conditions that I would never have taken on prior. I thought, what the heck, if I can correct their upper cervical distortion, maybe I can help them. And these people got better. My practice doubled. I was shocked, and I was having so much fun. But then after about a year of doing that, I realized, I can't very well tell John Stockton or Jeff Hornacek or any of the players that sprain an ankle, look, I'll just adjust your Atlas axis. You've got to be able to deliver the proper therapy at the right time. And so I integrated it all back. And what I discovered was that I had to make sure, before I did anything else, was make sure that the central nervous system was online. Because if that Atlas axis were off a bit and compromising the descending pathway through the brainstem that supplied the kidney's going to become a weakened organ. So the person's going to come in with kidney problems, chronic kidney infections, kidney stones, possible high blood pressure because the kidneys aren't working right. Everybody wanted to treat the kidney. Yet if you correct the subluxated, fixated area of the atlas axis, reestablishing that neural pathways, the kidney got better. And so I cleared up a lot of clutter systemically for patients. And then I could start to go into precisely evaluating individual muscle systems to see what really was happening. And it just clarified everything for me. And most colleges don't teach that concept. And that's why I think we're missing the magic, not necessarily the magic, because magic's a sleight of hand, the miracle of chiropractic. Because I know that the principal chiropractors who use basic upper cervical work are creating miracles. But it's one very powerful tool, but it's just one tool in the overall scheme of what human beings need to regain their health. And that's why I'm so committed to teaching these concepts and integrating these really good pieces of work, because the patients are going to benefit. And this world, as you well know, is screaming for healing.
Yes. Well, and it's one tool, as you mentioned. And, you know, I've been teaching the nutritional component and explaining to people the foods that they need, and the lifestyles and exercising. These are all tools. But, you know, when you have your tool, aside from addressing the specific injury or impairment, restricted range of motion and pain, once you address it with this technique, you get the side benefit of having the vertebral flow that emanates from the brain, so that you can really address the body more comprehensively, and all that good work you were doing in the other areas is this powerful synergy that allows you to really optimize your health and prevent disease in a really more powerful approach than you would be without it.
Exactly.
Yeah, so thank you for sharing that. And I'm wondering now if you could comment on the specifics on how you developed the technique, because actually I think it was in my second visit with you before I realized, you know, this reminds me of a technique I've had before, which was called MAT, muscle activation technique. And then I realized that was actually the words on your door too. But there was this, could you share the story of how you actually developed that? Because I had done MAT before for one of my initial hamstring injuries that actually turned out to be an adductor magnus tear from my ischial tuberosity. And it really impaired me for years. And I had abandoned the technique because after going to a local therapist who was a personal trainer and had learned this work, and it was very, very painful. Not that yours isn't completely pain-free, but it was more painful than yours. And I really wasn't getting results. So, and that's why I discounted it and abandoned that like 4 or 5 years before seeing you. And so I'm wondering if you could explain to the next, how you developed that approach with this other individual, and, you know, share the journey from there.
Well, Greg Roscoff is an exercise physiologist. He was a strength conditioning coach at Fresno State. And I met him through John Stockton. John's sister-in-law got married in Alaska, and she married a guy that played football for Fresno State and actually played pro football. And so Greg happened to be a friend of this football player and was at the wedding. And so they got talking, and when John got back from the wedding, he said, "Buhls, you need to meet this Greg Roscoff. He's doing a lot of really interesting work with rehab and range of motion." And so Greg and I got together, and I taught Greg how to test muscles, and Greg helped me see the value of range of motion analysis. And so together we worked with the Jazz over the course of, I think, 3 or 4 years, and he introduced me to the Broncos. So we worked with the Broncos the 2 years that they won the Super Bowl. And we had originally thought we would do a program together. And then he decided to go his own way. And the MAP work is based, it's a biomechanical approach that looks at origin, insertion, the muscle systems and the spindle cells within the system. And, you know, Beardall used that years ago, and it's a great tool. I mean, it can accomplish amazing things. But anytime you use one tool for everything, you're going to have conditions that just don't quite respond as well. And so that's how this all evolved. And I know that Graig is teaching a lot of people to do the work and making some really amazing changes for people. Um, but the key here is Beardall continued to ask the question, why doesn't it hold?
Mm-hmm.
We should never have to treat the same thing twice. If we do, we've missed something. So the patient comes in and I clear a muscle, and the next time they come in, the muscle's shut down again. I don't treat it again. I've got to go deeper to find out why it didn't hold, because muscles are the display units of the body. They can display so many things, not just neurological stress from the spine, but or a local injury, but it can also reflect organ gland imbalances, nutritional deficiencies, emotional stresses, dehydration, toxic burdens, cranial stress. I mean, if you have a concussion, there are certain muscles in your body that will shut down because of that concussion. And so if you treat the muscles and you don't address the cranium, they don't hold. So again, that's the key to this integrated approach, and why this advanced muscle integration technique is so effective. Is it takes the stuff that Greg Roscoff is doing, and it integrates, and it takes the cranial work and chiropractic and applied kinesiology, all these different things, and merges them together.
Yeah, I think part of the reason where it doesn't hold is the integration of Dr. Beardall's work with these neurovascular reflex points and acupuncture points, where you do that and integrate that with the pressure you're putting on the origins and insertions of the muscles. So that combination actually gets the long-lasting relief rather than the temporary relief you do with MAT typically.
Correct.
Okay. So I'm wondering if you can also explain the difference, how your work may differ from a traditional physical therapist who someone might see for a similar injury, other than the point that you already mentioned for the sprained ankle, which is clearly quite different.
It is. And, you know, in my view, physical therapy shines in post-surgical rehab, post-traumatic rehab, brain injuries. But when it comes to correcting athletic injuries, it doesn't have the effect. I mean, I remember when I ran track at the U, when we got hurt, we'd go into the training room, we'd get ice and stim and ultrasound. I remember I was so excited because I got my first tape deck, my 8-track, installed in my car. And so today, some 35, 40 years later, you get a sprained ankle, you go in the training room, you get ice, stim, not maybe ultrasound, but, you know, and you can put 1,000 songs on a little tiny credit card. You know, we've come so far technologically, and yet we're still using physical therapy modalities that we used 40 years ago. So we have to shift now within the context of physical therapy. There are newer techniques that have evolved, but I get people in my office all the time that have gone through months of physical therapy. The skiers that I have come in here that have been in rehab, physical therapy rehab for a year, and still can't do a one-legged squat. Peekaboo Street's a classic example. She went through 3 knee surgeries, reconstructive knee surgeries from a cruciate ligament tear. Now, I saw her 3 months out from the Olympic trials. She couldn't do a one-legged squat without falling over, and she was cleared by the U.S. ski team to ski all surfaces. Now, I did an exam on her, and I can talk about this because this is public information, but every muscle that supported her knee was shut down. She could not engage, and she started to cry because she'd worked so hard for a year to come back, and she realized that she, after all that, could not contract her quad, but how unstable she was on the table as I'm going through and isolating the muscles. And then I started treating her. I treated her for an hour and a half that session. I cleared a large part of the quadricep muscles. She got off the table, did a one-legged squat controlled, and she could contract her quads, and she started to cry again because she realized she could get better. It took me quite a while to get her completely balanced, but when I did, she was skiing better than she'd skied in her career, and she was the first to admit that. But it's an example of She had the best physical therapy care, and yet she was still unstable. And that's why so many of these athletes go back out and re-injure over and over and over again, is because the surgery was successful, but the instabilities are still there. And nobody knows how to evaluate those. And that's why this, again, is so powerful, is it isolates all those imbalances and shows the athlete whether unstable. And then they see the change, the dramatic change after the therapy, and their rehab just accelerates.
Yeah, it's also another example of someone who's highly committed and motivated and using every modality that they know within the traditional realm to get better, yet they're not. And I wonder if you can comment on my experience too, because when you examined me, I think I had over 80 muscles shut off, over 80. And what you said was above average, but I think may be partially related to the fact that anyone engaging in a program to improve their health through exercise is sort of the artifact of that. The natural consequence is you're going to injure yourself. Correct. And if you don't have a tool like you've developed to help the body get back to where it was before the injury, you're just going to get worse down the road. So if you can comment on that.
You can successfully adapt. And see, for you, you were able to successfully adapt because you're very athletic. But a lot of your muscles were shut down because the anchor muscles were shut down. So we don't have to treat all 80 muscles. But at the point that you entered my office, you had 80 or so muscles that did not engage properly. And I mean, you're an amazing athlete to be able to pull off what you do with all those imbalances. But I don't know that you ever really got out of shape, did you?
No, I was never physically out of shape because I was always committed and motivated, but it was very frustrating to see my physical health, you know, by that I mean flexibility, range of motion, pain-free, start to deteriorate despite this commitment. It was just driving me mad.
Right.
That's why I was so excited to find someone like, because intuitively I knew that something like what you developed existed. I didn't know where it was, but I knew that there was a solution, and it didn't involve wacky, crazy approaches. It was just simple and basic and foundational. So the moment I heard Jeff Hayes describe what you did, it just intuitively resonated with it. This has got to be a big part of the answer.
That's the thing that's so fun with this, is that when people hear about it, they intuitively know. I mean, it's just like the light goes, and then when they come in, it's like with you, it's like it makes so much sense. Mm-hmm. It gives you answers that you didn't get from other providers, and it gives people back their hope too.
Yeah, and their life. In my case, I mean, you know, my intention is to live well beyond 100 at full capacity, without any degradation in function at all. And I wasn't heading there, you know, before I met you. I was actually declining, which was really disappointing. So I have hope at this point. But I'm wondering also if you could, it's not an easy process. So I'm wondering if you could summarize what it is, because it's not, your program isn't something for everyone, because it takes a lot of time, because it may take about 10 to 15 minutes for each of those muscles to turn back on. And it's, you know, it's a number of visits, and then the other component is that there's not many of you who do this work. I mean, obviously you do it out near Salt Lake, and the chiropractor I'm seeing is the only one trained in the Midwest. Fortunately, she's only a half hour from my office or home, so that works out well. But the average person is not going to be really able to access someone, and I know you're in the process of addressing that, but perhaps you can discuss those variables now so people have at least a broad context to place this approach in.
Well, every muscle in the body has 8 reflexes that relate to it. There's an acupuncture point. There are 2 organ gland reflex points. There's the origin insertion of the muscle. There's three vertebrae in the spine, 2 of which are reactive. So all those reflexes have to be stimulated, but when a muscle is inhibited, all those reflexes will become painful. So a person will wake up one morning with pain on the outside of their elbow, and it really hurts, and they don't remember hitting themselves, but it's painful. So they go to the doctor, they diagnose them with epicondylitis or tennis elbow, and they give them anti-inflammatories. Well, that point may be an acupuncture point related to a muscle in the opposite knee. And so as we go through the therapy and we stimulate those reflex points, they are quite painful. People are kind of shocked at the fact that I can precisely isolate those painful spots. How did you know I hurt there? I've been hurting there for 6 weeks, and you nailed it, they'll say. So you go through that process of reactivating all those reflexes, and then you go back and retest the muscle for function. And it's not a comfortable procedure, but it's effective.
Yeah.
And so as we go through the process, people will get off the table and be able to do things they couldn't do before. And they get immediate feedback. You either turn the muscle back on or you don't. It's not like saying, well, let's try this for 3 or 4 weeks to see if it works. We get immediate change in the function of that muscle. Now, they may not be pain-free with that treatment. It may take weeks of regular care to finally get them enough stability to where the tissues heal and their pain goes away. I've had patients that took as much as 8 months of working through systems to get them finally balance out. But it's a commitment. But this is the only vehicle you're assigned, and if it breaks down, you still have to live in it. And so we've got so many people on 4 to 10 medications just struggling to survive, and you don't need that. The body has the ability to heal as long as all the essential components for healing are available. That's nerve supply, acupuncture flow, energetic flow, nutrition. Those are all critical components that have to be delivered at the right time, at the right level. And so, the frustration for me is finding doctors that will take the time to learn this work, because it is a commitment. And right now I've got 21 people trained to do this work around the country. I even have a practitioner in Turkey that took my certification last year. It's a 9-month program. They come in a weekend a month. Each weekend we take a certain part of the body, and we go up to the medical school and to the dissection lab and review anatomy. And so it's really a concentrated program, but the things that they learn, they take back to the clinic and they can apply that very week, and they see change in their patients, and their patients get excited. And it's easy to get referrals because people see the results and they refer their friends. And so my hope is one day to have this standard of care for everyone, not just elite athletes, but for everyone. And I really do think that this is a transitional technology, a disruptive technology. And I'm really excited about the future because of what's available for people.
Well, you've really uncovered a big piece of the puzzle. I mean, the tool that you've developed is just phenomenal and extraordinary. And I'm sure there's more than one way to achieve that, but you've certainly discovered one very highly effective approach. There's no question. In my specific case, I think the pain that motivated me to see you was my knee, my right knee pain. And I had been running for 43 years and probably quit 4 years before I saw you. And I never had pain at all when I was running all those years. But this developed, and I think, through a whole variety of muscles that were inhibited. And it didn't get better. I mean, you worked on them, and then the therapist, the chiropractor locally treated them. It took about 2 months or so before the pain to gradually finally disappear. But it's gone. It's not there, and I have full range of motion and strength, and most importantly, I can now engage with my personal trainer a rehabilitation program and strengthening program that's not inhibited, and I have good form, and I can do that, and then continue to improve, which is and I'm very grateful for having that function back. So thank you very much. So now, maybe you can expand also on how you can integrate this work with other modalities, because if they can put it in a proper context from that perspective.
Well, I think the jazz is a classic example of that, because we had a great training staff and we had a great medical staff. Although the medical staff didn't think much of me, they still did quality work. And so when an athlete had a medical need, they got the best care possible. And the value of an integrated approach is you take the best of all these worlds and you look at a patient and you say, okay, how do you see this patient? And so each discipline gives their feedback, which is a little bit different view. And then with that information, you come to a conclusion of the best approach for that particular case. And I think that we've gotten so far away from that in these specialty fields in medicine. I mean, you go to a cardiologist, and all he does is look at you from that perspective. And if he can't find it, then he'll send you to an orthopedist or an endocrinologist or a whatever. And we've gotten so far away from this integrated system because there's no money in the integrated system anymore. MDs make more money if they specialize. And so as a result, there's fewer doctors, fewer people going into general practice. And, you know, as a chiropractor, I'm trained as a primary care physician. But because the political climate with the medical profession, the AMA, the pharmaceuticals, we have been, you know, trounced on forever. We fight for our survival every year just to be able to stay in practice because of legislative changes that they try to make. And so I found that when you get the right people together with the spirit of helping each other, mm-hmm. you just have a lot better outcome. And I think that's really where national healthcare needs to move to. We have the ability to reverse this problem. I mean, C. Everett Koop, the past Surgeon General of the United States, in a speech years ago said that 85% of all health problems in America are the direct result of dietary deficiencies and abuses. It means that 85% of the issues that we deal with in America's healthcare system could be turned around simply by doing those two things: change your diet and start exercising. Mm-hmm. And yet we incentivize disease and crisis care, and we penalize preventative and wellness care. Just look at your insurance plan. They don't pay for hardly anything preventative, and yet they'll pay for crisis care, disease management. Mm-hmm. That has got to change. We've got to incentivize wellness, and that can change things overnight in this country.
Yes, and the exercise that they recommend, unfortunately, as I mentioned and shared earlier, you know, when even a highly committed person, if they have these muscles turned off, they're not going to be able to engage and participate in the exercise program because of this inhibition, and they'll just develop a pain and further injury. So thankfully your technique exists, but can you comment on how you integrate nutritional approaches into your program too?
Our soils are so depleted that you cannot get the nutrient you need even if you eat right, even if you eat healthy. So with the modern American diet, it's no wonder we have so many healthcare issues. So you have to supplement your diet with high quality nutrients. And as you well know, there's a big difference between nutraceutical level and pharmaceutical grade nutrients and stuff that you buy in the grocery store. But there's just a big difference. And so in my work, if a muscle doesn't hold, like I said before, I don't retreat it, I go deeper. And what we find many times is there's a particular nutrient that a person's deficient in. One of the common nutrients I find that people are deficient in is vitamin D3. You know, it's amazing. MDs are starting to do more labs to determine D3 levels, and what they're finding is most people are grossly D3 deficient. What's the impact of that? We're seeing an epidemic of osteoporosis. We're seeing an epidemic of cancer, heart disease. I mean, all those things that can have be influenced by vitamin D3.
Are you checking for vitamin K2 also? When you check for D3?
Yes, I do.
Yeah, because that seems to be another one almost on par with the deficiency of vitamin D3. And they work synergistically together. So, in fact, we encourage people now when they're taking vitamin D3 orally. Of course, the best approach is to get it from the sun, but many people aren't able to do that, is to take it with vitamin K2 also, because, you know, decreases the toxicity and also increases the synergistic benefits.
Correct. And I mean, you mentioned synergistic. people will take a particular vitamin. And what Dr. Beardall found early on in his research is that if you give a person a particular vitamin in high doses over time, it creates a demand for other nutrients to use it. And if you're not supplying that nutrient, you actually create a deficiency in that nutrient.
Right.
And so we go through from one deficiency to another, thinking we're doing something right. So he came out with what was called the core level product, which is a product that has everything in balance. A lot of your products have that balance to it. You take a lot of amino acids. You need other things to help you process that. So the closer you can get to whole food concentrates, the better off you are. But there are specific times where you need a particular nutrient to rebuild the levels to a healthy state. And then your diet and just general supplementation will cover all your bases. But the muscle system will actually help guide that in showing you specific nutrient deficiencies that need to be addressed. And I find we get a lot better outcome, a lot faster recovery if we supplement the patients with high quality nutrient.
Yeah, I couldn't agree more. And I see a chiropractor every week when I'm in Chicago to actually fine tune my approach and using the form of muscle testing to identify, because some supplements, I mean, it's really unusual. I mean, there's very few. I think astaxanthin would be one of the few that I'm taking every week. Usually some week I stop it for a while, and then I go back, or I change the dose from 1 to 3. So it varies. Your body doesn't have this rigid requirement that you need this amount indefinitely. You know, it seems to vary based on circumstances. I suspect that's your findings also.
Yes.
So unfortunately, unless you're connected with someone who's skilled with this type of testing, it's very difficult to do on yourself.
You know what I found too, Dr. Mercola, is that people will have an instinctive need for a particular nutrient, but because we become so skewed in how we see food, we'll eat more sugar, when in fact we need more minerals. You know what I'm saying? So we've lost that instinctive connection with our food and our body, and we have those cravings, but we treat the cravings inappropriately with foods that are detrimental to us. I'm sure you found that too.
Well, sure. Cravings are like pain in many ways. That they're a sign, they're a symptom that something else is off. And I find that when even in my own life until recently, I understood this whole issue of intermittent fasting and optimizing fat intake. You know, those cravings still persisted. But what I've learned is that once you're optimized from your diet perspective, the cravings disappear. It's not like you have to exercise this enormous discipline. And thankfully, one of the best gifts my father ever gave me, he gave me a lot of challenges, but one of the best gifts was discipline. I have enormous discipline, which is partly the reason why I've been able to achieve what I have. But even with that discipline, to suppress a craving is very, very challenging. But it's so much easier when it's not there. It's just not there. So and that's a clue that if you have a craving, that something you're doing needs to be optimized.
Correct.
Yeah. So just like pain, you know, pain is great. You should be thank God you have pain, because it's giving you feedback that something needs to change. Because if you continue the way you're going to hurt yourself further. So,
you know, years ago I heard about a Dr. William Tiller at Stanford University. He's a physicist, and he sent me a paper that he wrote, and the title of it was "Disease: The Catalyst for the Transformation of Man." And in it, he talked about how disease actually helped us move to a higher level of consciousness if we would let it. But historically, what's happened medically is that we tend to suppress those symptoms, telling the body, shut up, I don't want to hear it. And so we lose the messaging that the body's trying to give us to move us to a higher level of function. And so as a result, we just continue to go downhill year after year.
That's a good point. And thank you for reminding me of Dr. Tiller. I actually have seen him many times in lectures, because he's probably the most eloquent scientist. He's a physicist.
Yes.
that explains the energetic component of medicine. He does it in a very intriguing, compelling way. So he's definitely a tremendous resource out there. So I'm wondering if you can also comment on some of the other techniques that you use and integrate in your office, like nasal specific technique, NST, or network spinal analysis. You know, you've got a lot of interesting tricks, not tricks, but tools or resources that you integrate with what you developed.
Certainly. The nasal specific was, I learned that from Dr. Stober. He was a dual licensed naturopathic physician and chiropractic physician that practiced in Portland, Oregon. And I would spend time in his office talking to people, watching him do his procedure. And the gist of it is that the cranial mechanism can become compromised. You know, when you look at the human skull, there are sutures throughout the entire skull. Medically, they claim that the bones of the skull fuse. Well, reality is they don't fuse. They move every time we breathe. And if you look at a dry bone specimen of a human skull, you'll see all those suture lines. And for various reasons, those sutures can become jammed or locked so they don't move properly. So every time we breathe, those cranial systems expand and rotate, and they tie into the cerebral spinal fluid. Upledger, an osteopath, developed that whole concept of craniosacral movement patterns. But Dr. Stober focused primarily on the skull, and he treated kids with Down syndrome, with muscular dystrophy, people with sinus problems, migraine headaches, deviated septums, concussions. And sitting in his office talking to patients was like sitting there listening to miracle after miracle after miracle. And so I was fortunate enough to study with him. And so I've been using that technique now for 34 years in practice. And when it's appropriate, we see miracles. I mean, it turns people's lives on. A classic example, just a recent example, is Tora Bright. Tora Bright is an athlete from Australia. She's a half-pipe snowboarder, and she's been a patient of mine for years, and I can talk about this because this is public information. And 8 weeks out from the Olympics, she sustained a major concussion, severe concussion. The neurologist had her in a dark room. She was not able to read her brain. It was pretty significant. And when I heard that she had concussed that bad, I got sick to my stomach because she'd worked so hard for so many years, and we're like 8 weeks out from the Olympics. She came to my office 3 weeks later. She couldn't stand on one leg without falling over. She was that unstable. So we did an evaluation. We found tremendous stress on all the sutural lines in her cranium. And I began doing the balloon techniques. We insert a small balloon, the size of your little finger, into the nasal passage and inflate it and release it. We do that 4 times in each side. What it tends to do is expand the cranium from inside out and unlock those sutural lines and reestablish the cranial mechanism. So I worked on her for a week, and by the end of the week, she could close her eyes, do one-legged squat. She had complete stability. And a neurologist cleared her to start to train. Now, I treated her up to the time of the Olympics, the day of her event, and she was stable enough to win a gold medal in the half pipe. You think about that. 3 weeks or 6 weeks, and we had her back competing at the level of the Olympics.
Yeah, world class.
I tell you the number of patients that we've turned their lives around. Had a guy come in a few weeks ago with Meniere's disease. He'd had it for 6 years. Those who don't know what Meniere's is, it's an equilibrium problem. They have vertigo, they're dizzy, and he was on medications for it, and he wasn't getting better. I evaluated him. I found all kinds of cranial stress. He'd had a head injury. One cranial treatment, his Meniere's was gone. Now, that doesn't mean that all Meniere's cases are going to clear with the nasal specific, but in his case, it gave life back. So, little babies, the birth process can become quite traumatizing, and the cranial mechanism becomes compressed. They can't breathe through their nose. They have a difficult time nursing, they're colicky. We do that technique on them. It's like the switch turns on. They're like a different kid. Kids with learning problems. It's just a really amazing tool for certain conditions. And if I had to give up all my techniques, Doc, but one, I would keep that one.
Interesting. That's a very powerful testimony for someone with a range of tools like you have. Wow. So how often do you use it? I mean, where you would use that relative to what we colloquially call the Buhler technique?
Well, I probably do 2 or 3 a week.
Okay. Wow. So not that many, but when it's indicated, it's amazing.
Yes.
Okay. And how about the network spinal analysis? Is that the one that Donnie Epstein developed?
That's Donnie Epstein's work, and I was exposed to that. His work is really what got me involved with the upper cervical work, because in order to do his work, you've got to be able to toggle and adjust the atlas. And I wasn't trained to do that. So, I went to a number of his seminars and was blown away with the change. It's a very elegant, light contact adjustment. And his position is that when people go through emotional stress and trauma, the central nervous system goes into a state of contraction. It's more of an adaptive survival mechanism. And it's almost like, I guess the analogy would be like a rubber band that gets wound up tighter and tighter and tighter. The meningeal system is a tissue that surrounds the brain and the spinal cord, and they attach to little ligaments called dentate ligaments at the base of the spine and the upper cervical spine. And when people go through emotional stress and trauma, the meningeal system contracts and it pulls those dentate ligaments and can distort the vertebra from inside the spinal canal. And so regular manual adjustments aren't as effective. So what he discovered was by taking very light contact points on the sacrum and different parts of the spine and just holding it there, the central nervous system would begin to release that meningeal tension. Whereas a manual adjustment, which most of us use, actually becomes traumatizing. And those are the situations where people will have an adjustment and it hurts them. It's like the system wasn't ready to accept that kind of force into the system. So how I integrated that into my technique is that if a person is very facilitated, they can't relax, I can make a very light contact on the base of the sacrum and just hold it for a few seconds, release it, let the patient lay there for maybe a minute or two, come back, and the stress in their neck is gone, just like that. And then I can start to manipulate with less trauma to the patient. So Donnie discovered a very profound aspect of the spinal mechanism. And so what we observe in people who go through that process is after about 5 to 10 visits, their central nervous system begins to discharge. So you'll see people go through a rhythmic wave pattern all the way up their spine. Areas of injury will begin to contract in a rhythmic way as the body discharges that stress and trauma from the nervous system. It's an amazing process, one to experience and one to actually perform. So when a person comes into my office with a lot of contracted adaptive tension, I will many times do network clearouts initially to create more ease in their system. And it makes my job a lot easier with the adjustments and the muscle work. But Donnie's taught that all over the world for years, and it's really an elegant approach to the nervous system.
Yeah, especially when there's an emotional component going on, which seems to be an element of most diseases. So I'm wondering if you could comment on the top 5 pieces of advice you would have for someone working out in a home gym or a personal trainer at a regular fitness center, and how they could, what they would do, and especially in light of what you've learned over the years.
I think the most important things for people to understand that are starting a workout program is it takes 3 times longer to strengthen connective tissue than it does muscles. So what happens invariably with people that go into a gym and get a personal trainer is they start working out and their muscles get stronger, and then the trainer wants to increase the weight a little bit here, a little bit more there. Although the muscles can handle it, when you get to a certain level of weight, the connective tissue can't handle it, and that's when they get injured. And that's why so many people that start a conditioning program get to a certain point, get hurt, and they quit. So if you understand that, then in my view, the best way to start conditioning is to use light weights and do lots of reps to fatigue or to failure. So instead of doing, 100 pounds, 8 reps, do 20 pounds and do 30 or 40. The muscle strengthens, but more importantly, your connective tissue begins to develop and strengthen, and you'll run the risk of fewer injuries if you do that. Then the other thing too that I think is important for people to understand is they need to be properly hydrated, because that can lead to susceptibility to injuries. And if you have pain through an activity, don't do that activity.
That's a clue.
It's the mindset, no pain, no gain. That's ludicrous. You got to trust your body and change up the exercise. Do joint-friendly exercises, swimming, elliptical, biking, those kinds of things. But it's funny, have people come into my office and they're training for a marathon. Well, when's the marathon? In 2 months. Okay. So when did you start training? Oh, last week. Very much in the past couple of years, no, but I've decided it's my goal. I'm going to run a marathon. That's a recipe for disaster, So you gotta set reasonable goals and work slowly and begin to build to the level that you want.
That is fascinating. I didn't realize, until you just mentioned it, that it takes 3 times longer to strengthen the connective tissue than it does the muscles. So that is just a profoundly important piece of information to help to incorporate into your training program. And I suspect that you've heard of super slow. It's a form of weight training that engages, basically 8 to 12 repetitions at a very slow method. I'm wondering, it sounds like they're not really integrating that piece of the puzzle into it, and you're increasing your risk of injury without going up more quickly than they should.
Right.
All right, so that would make sense. Now, the other thing too, when I was in your office, it's commonly understood among most people who teach strength training that a squat is a profoundly effective form of training, might be one of the best lifts you can use. But you've had some negative experience with squats, and you don't recommend them, and I'm wondering if you can comment on what your perspective is on that, because I thought it was really useful.
I hate squats. I've seen
what
athletes
do you
rupture their discs.
But tell us how you really feel.
Right. No, it's true. I've seen more athletes rupture discs doing squats than anything else that I see. And you think about it, Dr. Mercola. You know as well as anyone that in order to do a squat properly, you've got to have perfect form, right?
And most of us don't. They don't have the hip rotation.
That's right. And no, you would never think about doing a squat with your spine rotated. Your trainer would look at you and say, no, don't do that. You're going to get hurt. You got to be straight. You got to get your hips under you. You've got to do it properly. Well, that's fine. But what if your L5 vertebra is rotated on one side? It's the same thing as rotating your spine and doing a squat. But you can't see that visually externally. So unless you're aligned through spinal manipulation, you're still distorted. And then the other thing that I'm finding is so many people that come into my office, their core stabilizer muscles don't work. And their low back muscles don't work. So here you're doing an exercise that requires those muscles and they don't work. So you're going to recruit into your abdominals, which are not designed for that. So the stress of weight bearing goes right into the facets and the disc. Now, one of the primary muscles that I find shut down associated with the pelvis is the transverse abdominis muscle. And when that muscle fails, it increases the stress on the L5-S1 disc by 50%. So you know, it's fine to do squats if you use light weights and you do lots of reps.
Mm-hmm.
You'll get the same benefit, but you don't load the connective tissue, and you don't run the risk of rupturing a disc. So you really have to be prudent in how you do those. Now, if you're, you know, an elite athlete, that changes a bit because you've got your core strength.
Yeah.
But again, so many elite athletes that I evaluate have core muscles that don't work. So they recruit, they shift their pelvis, they engage their abdominals a little bit more to try to adapt. And unless you've got a keen eye for proper biomechanics, as a trainer, you're going to miss that.
Sure.
So your client gets hurt.
But you like front squats you like a little better too, though, right?
Pardon?
Front squats you're a little more keen on?
Yeah, front squats are a little bit more user-friendly, but again,
Same issue.
same issue.
Okay.
Same issue.
All right, well, good. And now you've really provided a whole range of information to get people excited about your work, and I'm wondering if someone is interested in accessing your body of knowledge, what would be your recommendation?
Well, they can go to my website, which is aimatmethod.com, and there's a lot of testimonials, John Stockton, Peekaboo Street, some of those. There's information on each of the techniques, and then there's a list of providers around the country that do my work. And I'm starting a new training next weekend with doctors from around the country. I have a doctor coming from Italy, which is kind of exciting. I've got, like I said, a practitioner in Turkey. It's interesting about him. He certified, completed his program about 6 weeks out from the Olympics. He went with the Turkey women's basketball team, and they had to qualify to make it into the Olympics. So they had a big tournament in Russia and Europe. They came in and were able to qualify for the Olympics. And they made it up to, I think they made it to the semifinals, so they ended up coming in 5th in the world. And he emailed me and said, all those games, not one injury. Not one, I mean, that's just like, he's like a kid at Christmas time, not one injury.
Yeah.
So I wished I had more practitioners doing this.
Yeah.
I'm doing my best to enroll doctors into learning it. But I mean, they're more than welcome to call my office, and we've got a number of practitioners here in the Salt Lake, Ogden, Kaysville area that are doing this procedure. So we can take care of a lot of patients. We have people coming. I've got people coming from Abu Dhabi next week. You can imagine.
Sure.
Referred from Tim Ferriss's book, The 4-Hour Body.
Yeah. Yeah, Tim Ferriss is he's a big fan of your work too. I think you actually treated Tim, as I understand, and that's how Jeff Hayes found out about you. It was through Tim Ferriss's book, sorry. So that, you know, I think that's probably your biggest challenge. You've developed the work, you develop a technique that works and it's clearly effective, but the challenge is to really have a broad enough range of clinicians who understand and can apply it, and that someone can have access to. So I'm wondering, in closing, if there's anything we missed or anything you'd like to emphasize or comment on to let our viewers, some closing words for them.
Well, you know, I think at this point in our history, we are at a crossroads in our healthcare system. We can no longer continue doing what we're doing. We can't sustain the expenses of healthcare. People need to be more proactive in their own health, but they need to have options, and that requires that they educate. And I am so thankful for you and what you've done for the world, really, in your website and the information you put out. It's high quality, it's referent, it's changing lives, Dr. Mercola. And I know that you've taken a lot of heat through the years because of what you've said and the stands that you've taken, but we all really need to work together to educate the public as to what options are available for them to embrace their health and improve their health, so that we don't become a constant consumer of drugs and surgery. that should be the last resort rather than the first resort. And there are a lot of medical doctors who are frustrated because of the way the system has become. And they're moving more to functional medicine, looking at the patient as a whole, and integrating with chiropractors and naturopaths and acupuncturists, oriental medicine doctors. And I think that we're at a tipping point right now. This film, Dr. Jeff Hayes' film, is going to do a lot to shift that awareness for people. And I just heard there's another film being produced on back pain by a major filmmaker that should be released sometime next year. So there's a momentum building, and people are tired of the drug and surgical approach, and they're looking for answers. I'm amazed as I tell my patients, I ask them if they've seen your site. They've never seen it. Well, when I get through with them, they're signing up for your site because you've got a wonderful reference library of so many pieces of information that'll help people become more aware. So the Obamacare program, I think, was designed to fail. I think it's really designed to force a single payer government-run plan, which is not going to support health and wellness. It's going to support more disease management. So if we can teach people health concepts that they can use and see results, we can turn this thing around.
Yeah. Well, I couldn't agree more. And it's interesting that, and thank you for those kind words, but the principles that we teach, if they were given to people objectively without any prejudice, I think most people would clearly see the truth because it's pretty obvious. But that's not the case. And in fact, we recently uncovered, and this is an emerging story, and it may be broken by the time we air this interview, but there's a center for science, the Science Media Center, SMC, is a collective group of several hundred conglomerate pharmaceutical and biotech companies, some of the biggest companies on the planet, that have collected together and have their experts that the media goes to, that essentially forms the opinion and responds to virtually everything that threatens their model. So we've just learned this is the way it's done, and this is the reason why they've been so effective at suppressing the chiropractic profession, because that is just one of their high priority targets, and they just hit them every which way, and the media relies on them as the experts because these are well-respected professionals, and they have heavily influenced by and conflicted, and this is the way they're doing it. So our newest approach is to really expose this information to the public. And,
I think that's great.
Yeah, but this is the reason. This is the reason why we're having such a hard time, because this is not unbiased, impartial, unprejudiced. We've got these strong. It's really the classical battle between good and evil. And from my perspective, maybe I'm prejudiced myself and I'm seeing it in a different light. But it's interesting to see what will happen. Will bear harvest or bear fruit from this information. But I want to thank you very much for all your work. Thank you personally for providing a tool and a resource that's going to allow me to live another 50 years without pain and discomfort, and to continue to get healthier and stronger. I mean, I was so disappointed and sad that I was going downhill, but my life has really changed quite dramatically after encountering your work, and I'm just so grateful to have you really share it with me and provide the tools for other clinicians to help me grow my own health. So thank you for all you're doing, and I'm sure that many people will be inspired to learn more about your work and really reap the benefits themselves.
Well, thank you a lot.
Okay.